It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday. And indeed it is. It is Friday, May 21st. We're coming at you live from the Money Radio Studios in Scottsdale, Arizona, from the Scottsdale Air Park, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. And if this is your first time tuning into our show is about how our older adult population can live a healthier, happier life. How do we do this? We do this by bringing extraordinary guests to the show. The show's not about me. It's about the guests that I bring, and I am one of those people that is very interested in what they have to offer. So I am going to introduce our guest. Without further ado, is my good friend, Merrily Orsini. She's coming at us through technology, through the phone lines, as well as through video conferencing. Merrily Orsini, welcome to Health Futures.
Thank you, Bob. I'm so happy to be here today.
It is good to have you here today. And I will say this for our listeners, you are probably the most experienced person I know in the home care space. You and I had the pleasure of getting to know one another about 13, 14 years ago when I joined the Private Duty Home Care Association, which is an affiliate of the National Association of Home Care and Hospice, and you were our chair. And I learned a lot from you, Merrily, and I still learn a lot from you every day.
Thank you, Bob. That was a good time, and I think we did a lot of wonderful things for the industry. So thanks for being along on that journey.
Well, thank you. And, there's a lot I want to cover here, but I want our listeners to really understand about your background and the fact that I used the word experienced. Cypress Home Care has been here in the Valley since 1994. We're in our 27th year, and we are one of the oldest home care agencies here in the Valley of the Sun. But you were in this business 13 years prior to our even inception. You've been doing this, I think you said 1981?
Yeah, 1981.
And things looked a lot different then. And I'd love for you just to share with our listeners the evolution of home care. Because when I look at home care, I think the 90s was the time period where we kind of legitimized this space. I mean, there were folks like you that were doing it, but there weren't that many people around doing it. I mean, certainly there wasn't a franchise around when you started. And when we started, I think Home Instead had just gotten started, and I don't even think they had a location here in 1994.
Well, I think it was definitely a different time. And with the population starting to live longer, I believe that's what happened when I was interested, because I found that there really weren't services to allow people to age in place, to stay at home if they wanted to, and there were no rules, no guidelines. Really, I really created the model of business I created based on my consumer need. So it's funny now we talk about patient-centered care. Well, my whole model was developed with patient-centered care. And the model that I developed, which this is a mouthful, non-medical, long-term, care-managed home care. So that model where you use a care manager included in the home care product and the services to the home, that is something now that a lot of people say is the model that should be used, because the care manager, the geriatric care manager, now called an aging life care specialist, but that care manager is the one that helps the family and the person needing care decide, is home care appropriate?
Right.
Can they afford the home care? Do they have a support system that allows them to stay at home? Because, as you know, when you get frail, or you may not know when you get frail, but when one gets frail, then there's a lot of moving parts in terms of trying to stay at home because you're maintaining your house, you're trying to maintain whatever lifestyle you have, and then you also are dealing with whatever frailty has put you in the situation to try to stay at home and to have help at home.
Was there a personal experience? I don't even know this, so I'm asking this of you, Merrily. We've been together for a long time, but was there something that propelled you to really start this, or did you just see the need out there?
The need came to me, which is odd, but that's really how it happened. I started my business. Actually, I've never talked about this before.
That's okay. Right here, we're breaking news right here at Health Futures.
Right here. I had a friend who was at the Jewish Family and Vocational Services in Louisville, and she had a client who wanted to get out of the house, and his wife had what we now know was Alzheimer's disease, but at the time it was diagnosed as senile dementia. That lets you know how long ago this was. Mm-hmm. It wasn't even an appropriate classification or designation for dementia. But we accepted what was babysitting. That's what we called it, really. And so I had to sit her in a few afternoons a week for this woman so her husband could go out, and he died unexpectedly. I don't remember how long we'd been there. It seems like we'd been there a week or two. Maybe we'd been there longer, but I don't think so. I mean, we had just started the service, and so we inherited her. And she stayed with us the entire time I had the business, full-time, 24/7, 365.
Wow.
And because of her condition, which was new to me, I had a master's in social work, but obviously had never studied geriatrics. And so, because nobody was studying geriatrics at that time, it was before we even thought about the fact that we were going to have this burgeoning geriatric population that was going to need care. So anyway, that's how it started, and I got the master's level social work students. We had 3, at that time, programs in the community. We had Southern Baptist Seminary, we had University of Louisville, and there was a third one, Spalding University. So we had 3 universities that offered master's level social work classes, and so I actually got the students to work with me, and we created information about how to provide the care, training about how to provide the care. We researched and read anything that was available. At that time, the 36-Hour Day, the Mason Robbins book, which is still a wonderful resource book, that had been written. So we used that, and then trial and error, and we really came up with a way to care for people who have a dementia in their homes. And that was sort of a subspecialty early on for me. So I learned a lot about dementia. It was funny, the other day someone said they could look at people's eyes and see if they had dementia. And my friend was laughing about that. And I said, well, actually, I think I can do that. Maybe not with 100% accuracy, but that they can look that someone gets when they have a dementia is a distinct look that if you've seen it enough times, you do actually recognize it. So anyway, that was how I started in the care, and there were no rules, and so I had a fairly wide network in Louisville, and so people would find me. So in the beginning, which is odd because now I do marketing for HomeCare, but in the beginning, people were really finding me because there weren't that many resources. So I was at the right place at the right time.
No, for sure. And you truly are and were back then a trailblazer. I mean, you think about the things that you did, trial and error. I mean, these are things that were never done before, and I applaud you for going out to the universities and engaging and bringing forth those social workers, those masters and social workers to help you with this aging population. Fabulous. Well,
it was fun for all of us, and we really did provide amazing care, and created we created a certified training program that was early too, that we made all of our caregivers go through. So we got the Department of Education to approve it, and so we had very early certified caregivers that we did for the entire 18 years I had the business. We trained people and certified them. So we were ahead of the game in a whole lot of areas.
Sure you were.
We also had an arrangement with the four-wheel drive club and for bad weather. So we guaranteed staffing. That was another thing we did early on. We guaranteed staffing 100%. And we had a four-wheel drive club agreement. And these guys loved it. It would snow, and we'd call them, and they would pick up the caregivers and take them over to the clients and buy groceries. And so it really worked.
Well, I'll tell you what, we're down our first segment. We've got 3 more to go, Merrily, and I really want to talk about the evolution to what you did after you departed the home care space. But I will tell you, talking about training, really, it hits a chord with me in my heart, because that's something that Cypress really was built on, was training. You've been listening to Health Futures, Taking Stock in You. I've got Merrily Orsini here in the studio. Actually, I've got her coming in through technology. We will be right back.
Now back to Health Futures, Taking Stock in You. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You, and if you're just tuning in, we're in our second segment, and I am pleased to have my good friend Merrily Orsini coming to us through technology. I've got her here through my laptop on a video conference, but she's coming in through the phone lines because the phone lines are extra crisp and we can hear loud and clear. If you missed the first segment, you can catch it up on our website at cypresshomecare.com. Click on the media button, third button down is radio show. You can click on that and catch about 400 or 500 others that we've been bringing to you for the last 8 years. So as I get ready to talk a little bit more about Merrily, in the first segment, we learned a lot about Merrily and really what a trailblazer she was back in 1981, starting a home care agency in Louisville. Did I say it right, Louisville?
Louisville.
Yeah, Louisville. Now, and they all have that way of saying it. Most people say Louisville or Louisville, so Louisville. All right. So Merrily started a home care agency, was one of the first really to do it, and really embraced training and embraced bringing in outside help through the universities and bringing masters in social work, assisting folks that had senility, dementia, not coined as Alzheimer's, because we didn't know what we didn't know back then. We know far more today. And I want to just really, take really our conversation from there to now. And, you did that for about 18, 19 years. What did you do after you left the home care space?
Well, I started CoreCubed, which was the marketing company we have today. We're aging care marketing specialists now, and work on the entire spectrum, basically digital marketing. But I wanted to do something that did not require, and you will appreciate this, being on call 24/7, 365, and that when there was an emergency, it was not a life or death emergency, that I was going to be responsible for someone. So that seemed to, and I had a lot of experience and interest, and so that's really, really what I did. But 5 years, I had a 5-year national non-compete when I sold the company.
Wow. 5 years.
5 years. And 2 of those years, I worked at Patient Care, was the name of the company that bought me, and they were in New Jersey. And for 2 years, I served on their management team and helped with mergers and acquisitions that they were making. And then when that 2-year contract was up, then I started my business literally on the very next day. But I had that non-compete, and so you will appreciate this because you are so good at public relations and media. I had an interview for Fortune Small Business, and we actually had, and this is going to be hard for your listeners to believe, a 5-page spread, full-page spread in Fortune Small Business.
No way.
Yes, and they were fascinated by the fact that this was in 1998, and they were fascinated by the fact that I had planned a virtual business. now, of course, with COVID, everyone's used to having virtual business, we're talking from across the country. But at that time, it was a little before its time, and they were fascinated by that. And the other fascinating thing was, because of this Fortune Small Business spread, I picked up some amazing customers, my favorite of which was a football player. He played for the San Diego Chargers, and he had an idea to start a business, and he hired us to start his business for him. And that was so much fun because I had a team that I put together, all virtual, but we would go to San Diego. He played for the Chargers. We'd go to San Diego and meet with him. And then we did a conference for football players in Dallas.
Wow.
And we had big name football players there as our speakers. And it was all the NFL players and us, the group of people that were working for CoreCubed at the time. And anyway, it was absolutely one of the most fun things I've ever done.
So was it in the aging space this football player got into?
Not at all, no. His idea was professional business and financial network, and his idea was to help football players find a way to make money when they left playing football.
Wow. And
so it was really training them about business. And probably the most fun thing we did was we hired an etiquette person to come in, and we had lunch for the football players, and we taught them, how do you have a business lunch? Where do the forks go? Where do when you're sitting at a table of 8, which is your drinking glass? And, it was just hysterical to have a huge football player raising their hands, and saying, now, which fork do I use? So anyway, that was one of the fun things I did before I got back into home care.
Well, it's interesting, just so that, our listeners know, retired football players, especially with CTE, we get a lot of professional football players and college football players as clients that have, dementia or Parkinson's from all the years of wear and tear that they took in the league. And here you were preparing football players for business after the NFL. And I think the average lifespan of an NFL player is like 2 or 3 years. So they're not in the league very long. So, a lot of them are looking for, what do I do the rest of my life? So I think you were a trailblazer there too, in helping them, establish businesses and purpose in their communities and the things that they do every day. So,
well, it was a fun job, and but not as much fun as going back into home care when my national non-compete was over, and I got to go back into marketing of what I love, which is care at home.
Well, it's interesting, too. You talked about the digital space and how different the digital space must have been 20 years ago to what it is today. And, you and your team at CoreCubed are very proficient in web designing and SEO and all the stuff that, interactive marketing that you guys do. And you have to be proficient. You have to, because the web changes by the minute, if not by the day, and you've really got to be a great student on that, because the stuff that you were doing 20 years ago, let alone 20 minutes ago, is very different.
Exactly. Well, I wisely don't actually do the work anymore. I hire younger people who are very immersed in the current technology and who like to keep up with it. So,
no, it's smart. And you recently exited the CoreCubed business. You when I say you exited, it's still something that you're more in an emeritus role, but you're not involved in it day to day, right?
I am not. I have excellent managers that have been with me for a long time, and they're doing a great job. I am I'm founder, of course. I'll always be founder, but I'm chair of the board, so I still do attend board meetings, and I have a management meeting once a month. But other than that, I spend my time with Axxess, which is a global healthcare technology company, which, by the way, keeps me living longer and healthier and happier. So that would be my suggestion for people who want to have a healthier life as they age, is to find something to do that you really, really enjoy and that motivates you.
Well, there are a couple things I want to talk about with you, and I want to talk about that point that you just made. And I know that you have a little hobby with regards to glass, and we'll talk about that in the third segment. But talk to us really as we close this first half about Axxess, because there was an attraction for you to get involved in it, and I think maybe I'm wrong, but I think the attraction was more around the founder and how passionate he is, and I really would love our listeners and me to know how you got involved in working with Axxess.
Well, John Elajide, who is the founder, and actually he will kill me for doing this, but he just turned 40 this year.
No way. Wow.
So 7 years ago, when I started working at Axxess, basically as a consultant in their Care at Home product, the private duty home care product, when I started doing that, I jokingly on the first call said, I've probably been in home care longer than you've been alive, and laughed. Well, it was true.
So back then he was a 33-year-old kid. Now he's 40.
Exactly.
Wow.
Younger than my children.
But he's built a wonderful business. I mean, 7 years ago, I don't think I ever even heard of Axxess. And now they're for our listeners, they don't see it because they're not in the home health or home care field. But if you are, you know who Axxess is.
Well, and your listeners will know Axxess in the future, because John Elajide's vision, which he articulated to me the first time that we met, is that Axxess will be everywhere. That if you are interested in home care, you will be able to access that through Axxess.
Well, with that, we're here at halftime at Health Futures. Stick around. I've got a whole new two segments left with Merrily Orsini. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, we're in our second half, and I've got Merrily Orsini here, coming, I was going to say in the studio, but coming from Asheville, North Carolina, thanks to technology via the video conference that we have going, as well as the telephone lines. And if you missed the first two segments, you can catch them right up on our website at cypresshomecare.com. Click on the media button, third button down is radio show. And you missed a lot. We talked a lot about home care, and we talked about the fact that Merrily is probably the most experienced person I know in the business, and I've learned a great deal from her. Used to be on her board when she was the chair for the Private Duty Home Care Association, and she shared with us the home care agency that she founded, and she also talked about, at the end of the second segment, the fact that she founded also a digital marketing company called CoreCubed, which she still serves as chairman of the board, and she's involved in it more on the periphery. And she also shared with us for the last 7 years she's been working as an advisor, or I think you're an employee with this company called Axxess, and she shared with us the vision of their founder, and she's been helping them with their software called Care at Home. Did I capture everything, Merrily?
You got pretty much of it, Bob. That's good.
That's really good. Well, thank you. And, I want to take the second half and really talk about home care and where do we see home care going? Because, as I mentioned, you being the experienced person, you know where it's come from, and you see how it changes every day. And certainly we are challenged with a lot of things going on. And there are two things that really challenge us as home care agency owners, as well as care recipients are challenged with this as well, and that is workforce and getting enough people to work. And you said it best. We are, back in the 1980s, we weren't aging like we are today. We are an aging society, and here in Arizona, in the next 8 to 9 years, we're going to have more people 65 and older than we are going to have 18 and younger, and we don't have enough people. And I want to talk about that. And I also want to talk about the affordability piece, because affordability becomes a big, big challenge for us. The strive for the $15 minimum wage comes with some unintended consequences. And the biggest unintended consequence is that the population that we serve in home care is on a fixed income. And just because the workers now have to get paid more, how do we find ways for consumers to be able to afford home care services? So there's a lot to unpack there, but I would love to get your viewpoints on both of those very precious and important topics.
Very precious and very important. That's good. You know, one of the reasons that I joined Axxess, which is a global healthcare technology company, is because there are not enough people to go around to take care of everyone who needs care. You mentioned a couple of things. Number one is the staffing shortage, which is worse now than we've ever seen it in the industry nationally. And the second is the cost of care. So if we can, not that technology will ever replace people, but one of the things we learned during COVID is that there are a lot of situations where a phone call or a video visit can actually take the place of a visit. And so the idea that telehealth is being funded in some cases, the idea that some of the regulations, like Louisville, Kentucky is on the border between Indiana and Kentucky, so some of the regulations that govern Indiana don't govern Kentucky and vice versa. So some of those were actually reduced during COVID. So, and the government is taking a much broader and deeper look at what can the government do to help with the care at home industry. So I don't think we're going to have any immediate relief from both of those issues, the financial issue or the staffing issue, because the numbers are growing. You mentioned in 8 years what's going to happen in Phoenix. Well, that's going to happen nationally. In 2030, that first wave of baby boomers who were born in 1946 is going to hit the 85-plus range, which is really when people start statistically needing a lot of care if they haven't gotten sick earlier. But if you're not sick and die by the time you're 65, your chances of living to be 85 are pretty good. So,
right.
But you are going to, at some point, if you don't die in your sleep, you're going to need some kind of care because people do become frail as they get older. So I think as long as people are conscious about how we're planning for this and aware of the issues and using technology, I think we may have a chance at making this work. The affordability piece also comes in with that, because if you add in some technology, I mean, if you call a plumber or an electrician to come to your house, you're going to pay. Last time I had my toilet unstopped, it was $200.
Wow. And
that was because the man came, happened to be a man, but the plumber came to the house. So when you're talking about home care, you're talking about sending an individual into a person's home, which is the expensive part.
Right.
So, the getting there is the expensive part. So I think if we can really look at the future in terms of how we've made these changes during COVID, if we look at the future with an open mind and don't think that we're going to go back to the way it was and that we are going to have to come up with some different models of how to care and how do we share the care, how do we use technology, how do we actually make more efficient systems, I think we have a chance at being able to actually make this work for the future.
Sure. No, I think so, too. I mean, I think there are lots of ways we can problem solve this. And certainly you and I attended a conference that was hosted by Honor, the SAGE conference. And Dr. Bill Thomas was talking about, the Minka houses and building communities where you used the word share the care. And the concept behind that was he would build these communities and care type related services would be available to residents in those communities. So I think there's so many ways we can problem solve this. And the workforce piece is a big one, but I love what Axxess is doing, and I know others are trying to do the same, and that is embracing technology and innovating. And I think innovations are what is the secret sauce to America. That's what makes America great, is to not sit back here and say, oh, this problem is going to kill us. We're never going to see the end. Having the doom and gloom outlook. I think, we can do this. What makes our country great is people and ingenuity and innovation, and it sounds like Axxess is on the leading edge of doing that. So I think that's part of it. I like, when Bill Thomas, wants to put people together. I love the concept of intergenerational living. I mean, when we sit here and look at Arizona and Maricopa County, which it was funny because during the election, both sides, Republicans and Democrats, referred to the largest suburb in the country is Maricopa County in Arizona, and it truly is. And there's about 4.3 million people that live here in Maricopa County. And in the state, it's about 6.8 million. But Maricopa County is 9,224 square miles. And the challenge we have is home care agencies is how do we get people to, in the sprawling community, out to those homes to serve those folks? That's one of the big, difficult problem solves.
Well, can I talk just a second about one of the things, and this was John Elijah's idea?
So I want you to hold that thought because you can hear the music.
Okay.
Can we talk about that in the fourth segment?
We can.
We definitely can. And I also want to talk about some creative ideas to problem solve the affordability piece. You're listening to Health Futures, taking stock in you. Stick around for the fourth segment. Merrily Orsini is going to share some ideas. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. If you're just tuning in, I've got Merrily Orsini on with me. She's coming at us live from Asheville, North Carolina via technology. And what a great segue, the way the announcer introduced the future of home care. So we are talking about the future of home care, and we left off at the third segment that the founder of Axxess had some ideas that Merrily wanted to share as related to technology and really being able to provide care in the home utilizing some of these technology innovations. So please do share.
Yeah, I was just going to talk for a minute about Axxess Care, which is, and Axxess is AXXESS, and Axxess Care has been tested now in 9 states and just went national. But the concept is that anyone in any agency can find a person to go staff by using Axxess Care. So it's for the caregiver, the direct care provider, as well as the agency. Now, what it means is you are hiring someone basically sight unseen, but the software program has all of the checks and balances built into it, other than obviously an in-person interview. But what it allows you to do, if you are an agency, you can, and you don't have anyone to staff a case, then you can go into this pool, but it does it geolocated. So you talked about Maricopa County and how big it is. So instead of looking for your pool of caregivers, it's going to pick someone who is at Carefree if your client is in Carefree, or in Tempe if your client is in Tempe. So it's picking someone who's already in the area, already classified and certified and screened and everything. But anyway, so it's a great program, and I see it having a future.
Well, I want to learn more about that. That's really cool. And you know what? I think it important for caregiving, care recipients and caregivers, it's matching. And it's matching the needs of the care recipient with the skill sets of the caregiver. And it sounds like Axxess Care has come up with that, and they were doing it in 9 states, and now they're rolling it national. Or fantastic.
But the geophysical location is the key, because if you can go next door and take care of someone, that's a whole better utilization of personnel than you having 100 caregivers that service their own clients and another agency having 100 caregivers that service their clients. So,
through our partnership with Honor, one of the things that we learned is exactly what you're talking about, is that if we can keep caregivers within 20 minutes of where they live to their care recipient, we have an 85% chance or greater that caregiver and care recipient are going to be together more than 30 days. And I think close proximity is really the secret sauce to making caregiving and care recipient matching work.
Yes. Well, and John Elijah, they figured that out early. So
fantastic.
Congratulations to him.
Well, absolutely. Absolutely. So we talked about affordability, and certainly just in the last 5 years, the services for not only Cypress but others have gone up about $10 an hour just because of the costs and the labor. And, one of the things that has happened, and you've seen some of this as well, is that, our friends over in Washington State, the governor passed a bill back in 2019 called the Long-Term Care Trust Act. And that Long-Term Care Trust Act puts 50.58% of someone's wages into this Long-Term Care Trust Act pool. So that starts in 2022, and by 2025, you'll be able to access, if you've been contributing to it, up to $36,500 a year. So that's an interesting one for us to watch, because certainly people are not prepared for the cost of long-term care. I will tell you, and you probably experienced this when you were running your agency 35, 40 years ago, many people think Medicare pays for this. And we disappoint 50% of our callers.
Yeah.
And then when they find out Medicare doesn't pay for it, they think that maybe their managed care will pay for it, or maybe their supplement will pay for it. The only way you can pay for home care services is either through private pay. If you are on Medicaid and you have to qualify for Medicaid, you can't earn more than, I think, $2,200 a month and have more than $25,000 in assets. So you can do it via Medicaid. You can have veterans benefits, and veterans benefits are open to everybody. And the other one's long-term care insurance, and I think 11% of our population has bought long-term care insurance. So we need to problem solve. We need to come up with ideas. So as we wind down, I gave a little tease, I think it was in the second segment, some of the things that you are doing now that you've wound down your career with CoreCubed. Although you are working every day with Axxess and you are passionate about that work that you do, but you have this little thing on the side, this hobby that you do, and it involves glass. Can you share?
Collecting contemporary art glass is something my love of my life, Mr. Heath, my husband, and we are celebrating our 24th year of marriage.
Congratulations.
My company, Elder Care Solutions in Louisville, actually took care of his wife when she died of cancer in 1995. So when we got married, we developed a passion for glass, this contemporary art glass. So we have been traveling and collecting
the world
for 24 years. Yes.
Wow.
And I just there's the Art Alliance for Contemporary Glass is the organization that I joined early, and I was just served as president of that organization. It's an international organization for glass collectors, and I just came off as president of that organization for 2 years. But the funny thing about that is because COVID started, and most of the people who are in this organization are older, I would say considerably over 70 at least. And I started a weekly program, virtual, to showcase glass and artists while we were all locked up for that year. And it has been very popular, and it's still, I just went to one today. So every Friday at 1 o'clock, the whole organization gets together, and we still have 100 to 200 people on every call. So
wow.
And these are older people who absolutely were kicking and screaming about using technology. So at least I've introduced several hundred people to how to use technology on a regular basis to keep your interests alive. So, but the glass is something that I make friendships. I travel. It's really amazing. I mean, I just got a call yesterday. The Renwick Alliance from D.C. is coming to Asheville, and they're going to come over. So it's a great community and a wonderful way to meet people as you get older.
Now, you're collecting glass, but are you actually blowing glass, creating things? You're just a collector. And the others that are part of it, are they doing the same? They're just collectors?
Oh, I think sometimes people, dabble in it, but for the most part, they're collectors. Now, my art comes about in gardening. I have a very extensive yard and gardens, and that's how I That's what I do to have my artistic talent come out.
So we have about 90 seconds left. Is there a question I haven't asked you or something you would like to share with our listeners about Merrily Orsini or about home care that you would like to leave behind?
I would love for people to tune into my podcast, which is now in its 4th season, which is called Help Choose Home.
I love
available anywhere podcasts are available. And I do interview people in the industry regularly, but it's consumer focused. So it's really trying to teach people about home care and what they need to do to plan for it and how they can access it.
And you can access it via the Apple as well as Droid applications.
Any place. Yeah, even Spotify. We are everywhere that podcasts can be found. You can find Help Choose Home.
And I happened to start listening to the one you dropped yesterday or 2 days ago with Ida Banak. I love the work that you do, and I love the fact that you keep it to the consumers, really helping them understand how to help them choose home to be their place for care.
Well, good, and I'm hoping you will be a guest on my Help Choose Home podcast at some point soon.
Well, I'd love to do it. And Merrily, loved having you here on Health Futures. Thank you so much for being here and joining us. You make it a great day. Have a great weekend. We will be back next Friday.
Thank you, Bob.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.